as I mentioned before, in the last 7 years with the genomic testing and the tools that we now have, with new drugs coming on, I am in this luminal group of luminal breast cancer group, which is 80% of breast cancer. I'm using 50% less chemotherapy, so 50% of my patients don't lose their hair, don't have to have it because we now know it has no benefit to them. They are cured without it or don't need it. And I think with a test like the breast cancer index test and others that may come along or modifications of it, we will be using a lot less of these hormonal therapies, which we have kind of thought in the past, gee, no big deal, these aren't toxic, they're not, you know. On the other hand, we now know that compliance is terrible. UCLA did a study, a small study, where at 9 months, 50% of the patients had stopped their aromatase inhibitor, and a majority without telling their doctor. In that UCLA study, if we had this test back then when they did the study, we would have a much better fix on who really needs the drug and who doesn't. And many of those women that don't need it could sleep better at night, not feel guilty that they're depriving themselves of a potentially curative therapy.